Next, we'll move on to the ovarian tumors. In the ovarian tumors, we have surface epithelial tumors, then the germ cell tumors, then the sex cord stromal tumors, and metastatic tumors. So, the surface epithelial tumors are serous tumors, mucinous tumors, endometrioid tumors, clear cell tumors, and Brenner's tumor. So, each of this entity can either be a benign tumor or a borderline tumor or a malignant tumor. So, we have benign serous cyst adenoma. Then we have mucinous cyst adenoma. So, benign. So, when it is benign, you use the term cyst adenoma. While if you are telling borderline, you'll have to mention it as borderline serous tumor. Then, if you see it as a carcinoma, then you malignancy, then you have to tell it as serous cystadenocarcinoma. Okay. So, based on the morphology and in the presence of invasion on atypia, you are going to classify it into benign, borderline, and malignant. So, in serous, the lining epithelium is going to resemble that of the fallopian tubal lining. So, fallopian tubal lining is going to be ciliated columnar. So, here again you are going to see ciliated columnar kind of lining in the serous tumors. While mucinous tumor, you will have mucin. So, mucin was present in the endocervix, right? So, you'll either have an endocervix kind of a lining or colon kind of, intestinal kind of a lining. So, the mucinous tumors will have mucinous lining either resembling the endocervix or the colon. Okay. Then, in endometrioid tumors, it is going to resemble the endometrial glands. When clear cell and Brenner's tumors is present. So, Brenner's I will be discussing. So, the precursor lesion to endometrioid and clear cell carcinoma was endometriosis, right? Then we have various germ cell tumors. Dysgerminoma, again I told it is going to be the counterpart of seminoma in the testis. Then you have teratomas, which again we had discussed. Then yolk sac tumors and embryonal carcinomas and choriocarcinoma. So, all of this we had discussed in testicular tumors, so I'll not be repeating this again here. So, in sex cord stromal tumors, we have certainly Leydig cell tumor, then granulosa cell tumor, then fibromas and thecomas. Then in metastasis, we'll be discussing about Krukenberg's tumor. So, let me highlight some important facts regarding these ovarian tumors. Usually in surface epithelial tumors, especially the serous surface epithelial tumors, if you measure the carcinoma antigen 125, so CA125 antigen, if you measure it in the serum, it is going to be a biomarker. So, it is going to be very much elevated in the serous carcinomas. Then similarly, serous carcinomas will have a papillary morphology. So, papillary any morphology, I told it will be associated with samoma bodies. So, serous adenocarcinoma can also have samoma bodies. Then endometrioid carcinoma and clear cell carcinoma was their precursor lesion was endometriosis. Then you have a monodermal kind of teratoma also. Teratoma, I have mentioned that it is going to arise from at least 2 germ cell layers, right? But still, in certain exceptions, even if it is arising from a single germ cell layer, you can call it as a teratoma. So, what are the exceptions? That is when it is a struma ovariae or a carcinoid tumor. So, struma ovariae is nothing but there is going to be thyroid tissue present in the ovarian tumor. So, the thyroid tissue is present, then we call it as a struma ovariae, and that is a monodermal teratoma. Suppose there is a carcinoid tumor in the ovary, that is again considered as a monodermal teratoma. So, these two are examples of monodermal teratoma. So, struma ovariae, since thyroid tissue is present, they can produce thyroid hormone. They are functionally active also. So, they can produce thyroid hormone and they can result in hyperthyroidism. So, they are checking the body. The patient is not having any thyroid enlargement, but the TSH levels are low and the thyroid levels are high. And they are checking it, but it's a female. So, they do an ultrasound abdomen, and if they see a ovarian tumor, probably there is a struma ovariae, which is leading to this hyperthyroidism here. Okay. So, carcinoid tumor, it is going to produce 5-hydroxytryptamine or serotonin, and it can even result in carcinoid syndrome, though rare. So, there is a syndrome called as Meiggs syndrome. So, Meiggs syndrome is associated with ovarian fibromas. So, it's a triad of ovarian fibroma along with right-sided hydrothorax and ascites. So, from the ovary, remember peritoneal cavity is involved, then it goes on to the right side pleural effusion. So, right side hydrothorax, ascites and ovarian fibroma is considered as Meiggs syndrome. But ovarian fibroma is a benign tumor, okay? And like testicular tumor, in one of the testicular tumors, I told it was oil redo-positive, which was Leydig cell tumor. So, here in females, it is thecomas which are going to be oil redo-positive. So, males, it is a Leydig cell tumor, and in females, it is going to be thecoma cell tumor. So I'll be telling about Brenner's tumor alone in the surface epithelial tumor. So Brenner's tumor is going to be a surface epithelial tumor which can again be benign, borderline or malignant. And the classical image of this Brenner's tumor is it is going to resemble a transitional epithelium. So transitional epithelium is the urothelial lining seen in bladder. So it's going to appear like a transitional kind of a lining which defines this Brenner's tumor. So the classical another feature of this Brenner's tumor is the presence of the nuclear grooves. So in these nucleus, if you see, many of this nucleus is having the presence of nuclear grooves. So these nuclear grooves give the appearance of a coffee bean nucleus. So there are very few tumors which have this coffee bean appearance. So we have a coffee bean nucleus in the Brenner's tumor. Then we'll move on to the sex-cord stromal tumor. Firstly, we'll see about the granulosa cell tumor. So, granulosa cell tumor is a ovarian sex-cord stromal tumor which is known for producing estrogen, right? So, I mentioned this is going to produce estrogen. So, in the endometrium, it can produce a endometrioid hyperplasia which can turn into a endometrial carcinoma. So, other than that, this estrogen production can lead to precocious puberty in children also. So, it can either affect kids, children or even postmenopausal female. So, we have an adult type of granulosa cell tumor and juvenile type of granulosa cell tumor. Slightly, there will be morphological difference in between these two. So, immunohistochemically, if you see, granulosa cell tumors or any sex-cord stromal tumors are going to be positive for inhibin. So, what is the classical feature we see in a granulosa cell tumor on microscopy? So, it is going to be the presence of Kohl-Exner bodies. So, these are nothing but they form these kind of rosette kind of an appearance. So, tumor cells are seen arranged around some central pink material. So, there is pink material surrounding which there is going to be these cells which are arranged perpendicular to it. So, it appears like a rose, right? So, it is called as the Kohl-Exner body, and this nucleus again is going to have a nuclear groove. So, if you see here, it is all having some nuclear grooves. So, this again is going to be called as a coffee bean nucleus. So, Kohl-Exner bodies are seen in granulosa cell tumor, while Schiller-Duval bodies are seen in yolk sac tumor. Okay. Kohl-Exner in granulosa cell tumor. So, C and G look alike, right? So, C and G. While Schiller-Duval bodies are seen in yolk sac tumor. So, where all do you see coffee bean nuclei, that is nuclear grooves? Firstly, we can see it in, now only we saw Brenner's tumor. Then in granulosa cell tumor. Other than that, papillary carcinoma of thyroid, the nuclear feature are the ones which are defining it, and on that one of the features was nuclear grooves. So, papillary carcinoma of thyroid can also show coffee bean nucleus. Then we have Langerhans cell histiocytosis. So, in LCH also there will be presence of grooved nuclei. So, there again you can coffee bean nucleus. So, these four areas you are going to see a coffee bean nucleus. Then finally, we'll see about Krukenberg's tumor. So, Krukenberg's tumor is basically a metastatic tumor to the ovary which affects both the ovaries. So, bilateral ovarian metastasis will be there. So, ovaries will be quite large, but the capsule will still be intact. So, there will be no capsular breach, and this metastasis is going to occur via transcoelomic spread. That is, using the peritoneum, they are going to just spread but not involving the peritoneum. So, transcoelomic spread, it is just using the pathway. So, the most commonly the metastasis is going to come from stomach more than other gastrointestinal structures like colon, then breast cancer. So, classical morphology of these Krukenberg tumors is going to be signet ring cell morphology. So, in the stomach, where can you see this signet ring cell morphology? It was in the diffuse type of carcinoma, which is the leather bottle appearance, Linitas plastica. So, there we saw this signet rings producing cells. In the breast, it was the lobular carcinoma. Similarly, in the colon also, we have a signet ring cell carcinoma. So, the signet ring, there is going to be intracellular mucin, which pushes this nucleus to the periphery like a signet ring. Okay. So, all of these tumors can metastasize to the ovary, involving both the ovaries via transcoelomic spread. Okay, this results in the tumor in the ovary, which is arranged as this single cells, discohesive single cells, or even in sheets. So, this kind of tumor is termed as Krukenberg's tumor.